Hi there, doctors. Bill here. If you're on this channel, you're probably thinking of how to practice medicine in Poland as a foreign medical graduate. So I've been making series of videos on how to go by the process. The first thing I talk about was a general overview who is considered a foreign medical graduate in Poland. And the last video that I uploaded was on the Nostrification exam. So today we're going to continue our conversation on the Nostrification exam, and I'm going to give you an idea on how personally I studied for this exam, right? So you're going to bear in mind that there are two notifications that you're going to do. One is an exam, one is not an exam. So talking about the notification, which is not an exam, it's basically gathering your university diploma and your transcript and uploading it to a government website. And what the government does is that it reviews your diploma and your transcript, and then you get a notification that the education that you have is equivalent to the Polish one. So you can pursue, let's say, a further education, you can do a master's, or you can do a PhD in Poland. So it's very similar to EPIC verification for the US, Australia, or the UK, right? So the first notification, which is more of a paperwork, is, let's just call it the Polish version of EPIC. And then you have the proper notification exam, which is equivalent to step 2 USMLE exam. Why step 2? Because the notification exam tests you on clinical knowledge. So most of the questions are going to be clinical knowledge questions. You have to choose the right diagnosis. You need to know the symptoms. You need to sort of choose the right management of a patient, complications, like very, very clinical based. Every now and then you have one or two questions chipped in from basic science, but generally it's going to be clinical knowledge exam. It's a pretty tough exam. I'll be very honest with you. The passing rate, the statistics in Poland is not very good. Most doctors, unfortunately, are not able to pass on the first attempt. The reasons are, in my opinion, I would say that it's tough, first of all, and obviously the language could definitely be a barrier because the exam is going to be in Polish. Rightly so, you were planning to study medicine in Polish. So, I mean, you shouldn't even be surprised that the exam is going to be in Polish language, right? I decided to use a completely different approach to prepare for this exam. What I know is that most doctors actually use what we call Lepolek. So Lepolek is more like the Polish question banks, but this Lepolek is actually made for Polish doctors, right? At the end of the study year, Polish doctors have to take an exam called Lekarski Egzamin Końcówka. This exam usually focuses on Polish students, not foreign trained doctors. So Polish doctors or medical students tend to use this database of questions or question bank. But as a foreign trained medical doctor, there is really no such question bank for you. So you basically have to read at large. So in my case, I used Anki cards, which is very popular among USMLE step takers. I used Anki card based on UWeld, so the focus was on step 2. Obviously, I did go through a lot of question banks. I did go through UWeld, and I did also go through like the Australian question banks and also past medicine, which is very popular for UKMLE test takers. Because at the end of the day, medicine is the same everywhere. There's no such thing as American medicine, Asian medicine, African medicine. So if you have good knowledge of clinical medicine from a language you understand well, you should be able to transfer that knowledge only into Polish language. So personally, I would split my screen into two. One side I had Google Translator. The left side I did have my question bank, or let's just say UWorld. So what I would do is I would translate all the symptoms. I would translate the investigative test, and I was also very interested in knowing the names of the disease in Polish language, because the names of diseases in Polish language tends to be completely different. So, for example, appendicitis is going to be zapalenie wyrostka robaczkowego. Let's say pneumonia is going to be zapalenie płuc. Hepatitis, zapalenie wątrobowe. Let's say rheumatoid arthritis is going to be a zapalenie rheumatoidalne zapalenie stawów. So it's just completely different. You really have to sit down to study all these diagnoses in Polish language. So yeah, I would actually advise you to study in English. Study in English, obviously, because the statistics with regards to the pass rate is not very good. Also, another important quest is to sort of decide where you want to take the exam, because these exams are organized by different universities. It's not like the UK where the exam is organized by the General Medical Council, or in Australia, the Australian Medical Council, or in the US, it's organized by a central body, ECFMG. Here, there is no central body that organizes the exam. The exams are organized by individual universities with medical faculty. So you have to go there. And each university organizes the exam in their own way. The pass mark can be different. In some universities, the exam is oral, so there's going to be a commission of doctors, and then they will throw questions at you. So specifically in Warsaw and in Olsztyn. Olsztyn is a city in Poland. It's pretty beautiful. I've been there several times. Yes, they conduct the exam more on like oral exam base. But many universities are more like paper based, which is multiple choice questions. So it's also something that you need to figure out. But from what I know, the statistics from all the universities is not good. Not more than 50% passes the exams in most universities. In some universities, it could be just 20% pass rate. In some universities, it could be just 15% pass rate. So the statistics is not good. And I would urge you to read and study in a language that you understand, because at the end of the day, medicine is the same everywhere. So if you ask me for my opinion on how to study for the exam, use the USMLE material, which goes deep into questions, and also you'll be able to pick up important medical concepts. So that's it. If you have any questions, you can always write in the comment section, and I would be happy to make a video to answer your questions.